Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning. We're going to be speaking with Dr. Wayne Jenkins in this segment. He's Chief Medical Officer of Centivo. It's a new type of health plan for self-funded employers anchored around leading providers of value-based care. He's going to talk about the company's mission to bring affordable, high-quality health care to millions of workers, findings from the company's 2022 healthcare spend analysis, and more. Welcome to Health Professional Radio, Dr. Jenkins. Thank you for taking the time this morning.
Thank you. Thanks for having me.
Well, tell us a bit about yourself, your professional history, and what ultimately led you to join Centivo.
So, Neil, I started out as a radiation oncologist in my professional career following medical school and training. I became director of a cancer center and then subsequently the chief medical officer for 2 health systems and the president of a physician organization. During that latter part of what I described, in one of the health systems, particularly in Florida, we put in place a value-based care program around what we would call an accountable care organization. And that was a primary care-based program that was intended to increase quality, lower costs, keeping people out of the high-cost settings, hospital, emergency room, for example. So that was my beginning of my clinical career and then director administrative career. And with that type of work, Centivo, as it was beginning, I joined them 4.5 years ago, they had a similar mindset of taking value-based care providers, health systems, and connecting that to employers through a health plan. And that's when I decided to move from the healthcare delivery provider side over to the payer side with Centivo.
So explain a little bit more exactly what it is that Centivo does. What solutions are offered?
Centivo, as you said at the beginning, is a health plan for self-funded employers. And the model is for Centivo to look for health systems or clinical delivery systems that have a value-based model, high quality, more affordable cost, for us to partner with those clinical entities and then connect that to the employers with a benefit design and a health plan that gives that high quality, more affordable cost to their workers. So Centivo is a health plan, but we're looking on one side for the self-funded employers that need that, a more affordable, high quality care for their employees, and then connecting that back to those health systems and providers that have that similar mindset.
Does that provide more choices or does it limit a patient's choice?
So I think that's an interesting question about choice, because in a marketplace, and I'll use Southern California, for example, we have partner providers. For example, in Los Angeles, it's UCLA. In Orange County, south of there, it's Memorial Care. Further south in San Diego, it's Scripps. So if one looks at it in the sense of, is that less choice? That's not everyone in the market. So that may be less choice in the sense of a patient couldn't choose everyone. But I think what we do that really gives people a choice that is not out there is that this care becomes more affordable. The patient member of the health plan has more economic choice than what's traditionally out there. So in my mind, by limiting from every health system provider out there, someone gets more economic choice.
Can the quality of the benefits be maintained or even improved while still reducing cost?
So that is fundamental to what we're doing, that improvement and maintenance of quality while reducing cost. So if you just think about those 3 health systems I provided, they're at the forefront of high quality care. So Centivo will go into geographies, markets, and it's not only a cost function, but it is that who are high quality providers that have this value-based primary care centered mindset. And that's what maintains the quality. So absolutely, we can maintain or in many instances improve the quality while providing that that cost benefit.
Now, I said in the introduction that Centivo recently released some findings from your 2022 healthcare spend analysis derived from your partnership plan. Talk about this analysis and what some of the results revealed.
So the partnership plan is the plan that we were discussing in which someone chooses a health system, one of our partners. They have a primary care model. They have a primary care clinician team that oversees their care. So that's fundamental to the partnership plan. What we looked at in this value-based study is across the markets where we were doing this, how did the cost and utilization compare to benchmark studies? And the benchmark is by Milliman, a national well-respected actuarial firm that is the leading publisher of these type of results. In that study, the cost savings were between 20 and 30%. But I think what is really interesting, in addition to that, is some of the utilization. And in that model that I described, where someone has a primary team that provides good access, and it's free to the member, our primary care utilization went up 20 to 30% in markets. And then the corollary to that is ER visits went down 15 to 20%, and hospitalizations went down in that 15% range. So in every market we go into, what we want to see through that better access and free primary care is primary care to go up, and then the high cost utilization of ER and hospital go down. And that's what we published in that study.
What is Centivo's virtual primary care offering? How does it differ from, traditional telemedicine?
In the process of the last couple of years, particularly when COVID came, we saw the opportunity that people were using more virtual care. But what had been in this sort of virtual online care is often had what we say episodic care. Hey, I have a sore throat. I can get online, see a clinician, and do I or do I not need a prescription for this? An example. But when we talk about virtual primary care, which we instituted 2 years ago, it is the same team. It's the same team caring for that individual and looking at all of their healthcare needs, just like if you see a primary care doctor in an office. And we were very pleased last year. We were one of the first virtual primary care to receive patient-centered medical home accreditation by the National Committee for Quality Assurance. So they look at how we're delivering this virtual primary care and say, okay, that's very consistent with high-quality in-person primary care. So we put that in place, and it was very important because even with the plan we had, we would see, 15 or 20% of people not choosing a primary care doctor, a term we would say medically homeless. But with this, we've been able to increase really to, in this 99% range of people having a primary care doctor, either in person, which is great, or for those that need this type of virtual access, we can set up a virtual primary care that we've done through Centivo Care.
Give us a website where listeners can learn more about Centivo.
To learn more about Centivo, they would go to www.centivo.com.
Wayne, thank you so much for your time this morning. It's been a pleasure speaking with you. Hopefully we'll have an opportunity to speak again.
Thank you, Neil. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Wayne Jenkins. Audio copies of this program are available at hpr.fm, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.